Western University of Health Sciences. I currently work with our Osteopathic Medicine program as well as our Podiatric Medicine program. And then here's my email, but I'm also going to type it in the chat and it's at the end as well if you ever need to contact me. All right, so we're going to dive right into it. We're going to look at the difference between an MD and a DO. So we are an osteopathic medicine school, which means we are DOs. Allopathic is MDs. You can see that there are similarities between both, but as well as differences. So for an MD, we focus on the person and the lifestyle to treat conditions. One of our biggest philosophies here at Western U is focusing on the mind, body, and spirit, while MD focuses on diagnosis and treatment. One of the major differences between a DO and an MD is going to be OMM, which is osteopathic manipulative treatment. And it's using your hands to diagnose somatic dysfunction as well as using manual techniques. And it's really just to improve the function and restore balance to the body so that the body can self-heal rather than using medication. As a student here at Western U, you'll be using OMM within your first day of classes. Why Western U? So there are a lot of great things about Western U. One being interprofessional education. Interprofessional education is how we get all of our students from different programs to work with each other. So as in your first couple of years, you'll be working with maybe a dental student, a vet med student. You guys will be handed a case, and the case may be, why can't the dog walk? So as an osteopathic medicine student, you're like, why am I working with dogs? But it's for you to really learn what other students do in their specialties and create forever networking. Another thing is we have our patient care center right on campus where we see over 10,000 patients in the area, and really allows our students to work on these patients, work together. It's part of one of our rotations as well. And I'll get a little bit more into that later. We have longitudinal tracks, which are preclinical elective tracks that provide students with opportunities in patient care, community service, and scholarly activity. Some of those tracks look like a chronic care track. So you'll be following one patient along with their family for the first 2 years. And that means going to all of their doctor's appointments. If they go to the ER, you go to the ER. We have international tracks. We have anatomy tracks. It really just depends on what you're interested in. A lot of our students choose to join our tracks. Again, and these are in your first 2 years, so your preclinical years. On top of that, we have over 130 student-run organizations such as clubs, student government. We also have our urban campus, which is located here in Pomona, California, as well as our rural campus, which is located in Lebanon, Oregon. So we have Comp Pomona and Comp Northwest. We are sister schools, but you do have to apply to both. So you can't just apply to one and it goes to both campuses. And then we try to promote a collaborative environment. An example of our collaborative environment is going to be, as an osteopathic medicine student, you're never going to know your ranking in your class. You'll never know your cohort's ranking either. And really, we do that to make sure that we're promoting a collaborative environment rather than a competitive. So just to highlight a little bit about our patient care center, we service over 10,000 patients in the local and surrounding communities. It's a really great way to see what goes on in our community and how you can give back. Our first floor has our eye care center, pharmacy, second floor, medical center, and foot and ankle. So as an osteopathic medicine student, you'll be in your medical center on the second floor, and then our third floor is dental. I'm going to dive a little bit into our curriculum and clinical experiences. Your preclinical education, like I said, is going to be the first 2 years. It's integrated blocks of sciences and clinical skills, again, as well as starting your OMM specific courses and labs. Your first year focus is all on normal functions of the body, health and wellness, and second year focus is restoration of the health, diagnosis, and treatment. Once you move out of your next 2 years, you're going to be in your clinical years. So your third and fourth year are your clinical rotations. Your third year, you're going to have core rotations. If you can see on the left, these are all your core rotations where you're going to be. Our rotations are lottery based. So you can kind of go all over California, if I'm going to be honest, in the Southern California area. And then your fourth year rotations, we have 3 required rotations and the rest are electives. And electives are what we call kind of building your way into residency. So there may have been a hospital that you rotated with in your third year that you fell in love, or a specialty, and you want to see a little bit more what it has to offer, get your name out there, and that's going to be one of your 7 electives. We also do have international rotations, and this is typically if you join a longitudinal track that's meant for international rotations. And then I'm just going to go over a couple admissions applications and the process. On the screen, we have our prerequisite courses. So I believe UCSD is on a quarter system, if I'm correct. So you would need 12 biological sciences with a lab, and these are units. 12 units of organic chemistry with the lab, 12 units of general or inorganic chemistry with the lab, and 12 quarter units of physics with the lab. And then we also do require 9 quarter units of college English, as well as 9 quarter units of behavioral sciences. And if you're ever unsure about your courses, you can reach out to your admissions counselor. We actually have a course subject list that we get from ACOMAS, which is where you would be applying. And from there, it kind of lists all these courses that we accept. And if there was ever anyone that maybe is on the fence, again, our admissions counselors can really deep dive getting a course description and speaking with our director about it. We do require other requirements, so a bachelor degree. You can also apply with a bachelor's and a master's. We require our MCAT. The score cannot be older than 3 years. So if you were to apply to next cycle, you would be looking at MCATs taken from January 2021 and so forth. We do have a competitive average for our MCAT score. That score is going to be a 509. It does change every year as the new class comes in, but last year and the year prior, we sat at 509. And when I say competitive average, it's the average of all applicants applying that got in. So they could have below that or above that. But it's just kind of an average where you want to test around. And then we do have 2 letters of recommendation, one from a physician, and that has to be an MD or DO only. We do prefer DOs, but it's okay if you only have an MD letter. And then one from a science professor or from a university health professions committee. And this is our application process. So you're going to go ahead and start your application on ACOMAS. It's AAC-OMAS. The primary application opens on May 5th. Typically, each year it's going to be the first week of May. And then the deadline is always on February 1st of the following year. So for example, the application for 2025 will be opening May 5th of 2024, and it will close February 1st, 2025. We do send out secondary applications, but it is selective. Each application is reviewed holistically by our admissions committee. And then the secondary application fee is $65 with an additional CASPER test. The CASPER test is more like a situational judgment exam, I would say, kind of similar to MMIs. And then our secondary deadline is always 2 weeks from receipt, so about 10 business days. And really, we give you this deadline just to make sure that there's no delays in processing. So a look at our interview day. So you have a panel style interview conducted by faculty, current students, or other comp staff. And then we have various presentations, a curriculum overview, admissions, program highlights, financial aid. And then on that same week on the Friday, you're going to have a multiple mini interview, which is what we call an MMI. And it's a patient scenario simulation with a standardized patient. You do not need to have any prior medical knowledge for the MMI. It's quite literally just a standardized patient, kind of like the CASPER judgment awareness, all of that is being tested. And then we're going to dive into an ideal candidate. So ideal candidate is someone that meets our competitive range. So in academics, our GPA, the average overall GPA for our class is about 3.68, while the average science GPA is a 3.63. And again, that average MCAT score is a 509. So academics, you want to be falling within that range. Exposure to DO. This is so important for an ideal candidate. We want to see you shadowing a DO, getting a letter of recommendation from a DO. It's kind of hard to find a DO to shadow, and we do understand that. A lot of our applicants tell me that they have to cold call all the DOs in their area and other areas, but they do make it work. We like to see community service. One of our biggest philosophies here at Western University is giving back to the underserved communities. So if you're doing that and that's in your application, that's really going to stand out. And then leadership qualities. Have you done research? Have you taken, have you volunteered a lot? Just kind of those qualities. And then again, all aspects are weighed evenly, so we do weigh them holistically. We do understand not everybody is a competitive applicant for medical school, but we do offer other options such as CPM, so Doctor of Podiatric Medicine, optometry, Masters of Science in Medical Sciences, and other Western U programs. We do have linkages. So if you have any questions regarding those, you can always reach out to me via email. And we do have advising appointments. We also do campus tours as well as preview days. And our advising appointments, you can hop onto our advising portal and select a time that works best with you and meet our advisors, or virtual, phone, or even come in face to face. And then this is my information right here. Any questions? I'm going to go ahead and take questions now, but here's my email and my direct line if you ever wanted to reach out to me. And then just an extra, join us for preview day. Our next preview day is March 2nd here at Western U. Really neat. You can select the program that you're interested in, receive a tour, talk to the dean, talk to students, and really get to know the program a little bit more.
Awesome. Thank you, Coral. I did have one question about clinical rotations. You said that those are, and you said around Southern California, just in general. Can you tell me kind of how that works, how rotations work, and how that ties into residency matching?
Yeah, so our rotations are around Southern California. I think the furthest being Bakersfield, California. And really, they are lottery based, so you can't select where you're going. But how that works is often our students, I know the biggest thing that people worry about is housing when that comes to rotations, because you're rotating for 4 to 6 weeks. So a lot of our students get an Airbnb together and they do their rotation there together. But really, we have people rotating in LA, Temecula, Riverside, and you're really getting to experience different communities and trying to see what community fits best for you. And there might be certain hospitals where we have specialties and other hospitals don't. So that kind of falls in your residency of, I really liked the hospital here in Beverly Hills or in Temecula Valley. And so when it comes to your 4th year for your elective rotations, you can elect to rotate there again, which is we call setting you up for residency.
Awesome. That makes sense. Thank you. We have a question in the chat. Can you please explain the longitudinal tracks further?
Yes, so we actually just started the longitudinal tracks quite recently, and they're educational programs that are organized and around a specific theme of interest. So we took a lot of interest that our students were, really seeking in their first 2 years, because it is preclinical. You are getting hands-on experience. You're in our simulation lab. But, when it comes to specialties, some people might have something already selected in their heart, maybe from a past experience that they really want to further upon. One of those being chronic care. Really to be able to follow people and see, okay, how does a chronic condition affect somebody's life? How does it affect their family's life? So we created these. They were almost experimental at first, but now we have over 700 students in each program enjoying them. But yeah, they're really just elective tracks that you do for your first 2 years. I will say it's an additional work on top of your medical school requirements. So if you're not ready to take that jump just yet, you can always do it just in your 2nd year, but it's more within your 1st and 2nd, and then you might see it pop up again in your 4th year for that rotation.
Awesome, thank you. So I'll kind of prompt the students if you want to ask any questions. Feel free to put those in the chat or unmute yourself and go ahead and ask the questions.
And maybe if you're too shy to ask a question right now, I'm going to pop my email into the chat. Feel free to email me really at any time. I get back very quickly. If you have any questions from today, I'm more than happy to answer. Okay,
Awesome.
average stats. I can go over the average stats again. So our competitive average for our overall GPA is a 3.68, while our competitive average for science GPA is a 3.63, and our MCAT is a 509. And again, these are just averages taken from a class, so it doesn't mean you have to have this GPA. You can have lower, higher. It's just somewhere where you want to be.
Got it. I guess this is my last question. If you could kind of explain again the difference in admissions to a DO program, say at Western University, as opposed to say an MD, maybe a comparable MD program.
Yeah, so for admissions for DO programs, a lot of us are on a rolling basis, meaning that we are interviewing, taking applications, accepting, denying, withdrawing all at the same time. Um, Really, that is the biggest difference because I know MD schools do have a select month in the year that they send out their acceptances, whereas for us, the students that we start interviewing about 2.5 weeks after that, we start sending out acceptances. So I'd say that's the biggest difference between DO and MD schools. As far as what I've heard from students that I've worked with in the past, a lot of DO schools in Western U in specific are the only ones that offer individual advising appointments and the ability to really get to talk to an advisor and work through applications as well.
Got it. We have another question. Would you say that there are advantages to pursuing a DO over an MD in long-term career?
I really think that this question can be answered in multiple different ways and from multiple different perspectives. An MD and a DO are both doctors. They're both great career pathways. But working with a doctor as a DO and in the DO school, I think it really depends on who are you as a student, who are you as a person as well. Because like I said, our DOs, we focus on healing the mind, body, and spirit, not just diagnosis and treatment. So if you're somebody that really wants to get to know your patients, work with your patients, and get to know their lifestyle, the people that they surround themselves with, I think that's the best route for you to go. But again, if you're also interested in MD, which is more diagnosis and treatment, I feel like with MD, you don't see your outcome with your patients as much as you do with a DO.
Another couple questions. What do you recommend to apply for the, I guess, to apply to the DO program the first day the application opens, or can you apply a little bit later, say in June or July?
Yeah, so really, when that application opens, a lot of people are going to apply at the same time. Typically, we get about 7,000 applications per year. I will say for processing, it does go a little bit faster if you are applying early, but you can apply May, June, July and get the same processing time. It's really when are you ready to apply? And I really want to stress that out because I don't want you to feel like, okay, it opened in May and I have to apply right the second and maybe not feel ready or have all the items that you may need to apply.
Absolutely. It's kind of balancing, making sure all of your elements are ready to go while also submitting them in a timely manner because it is rolling admissions, right? So as people are applying, spots are being taken up as people are being offered interviews, right? So
That
yeah,
is
it's kind of
correct.
a balancing act. Okay, cool. It looks like this is the last question we have so far. What are the most common ways students get clinical experience and what can help a student stand out? And what are the average hours for students? And this question is in the chat if you need to refer back to it.
Okay, thank you. So a most common clinical experience we see our applicants get is working in a hospital as a medical scribe, a medical assistant. I know for some people that's not possible because you're in school, you're working a different job. So we see a lot of people volunteering in research labs. Keep in mind your clinical experience doesn't have to be something that you worked in. If you're volunteering in a clinical field, so we have a lot of people within the past couple of years volunteer at COVID sites. That's another way to get what we call clinical experience because you're working in that medical field directly. As far as clinical hours, there is no minimum, there is no maximum. We understand that everybody comes from different walks of life because we do have people that apply that worked as an LVN or an EMT. They're going to have a lot of hours compared to somebody else, and that's okay. But I would say for myself as an admissions counselor, I always tell people at least get 40 hours.
Okay. That's actually really, that's not a ton because we kind of tell students a few hundred hours, so maybe 150 clinical, maybe 300 healthcare. So I guess it depends.
Yeah.
Thank you.
Mhm.
Cool. So it looks like that was our last question. I want to thank you again, Coral, for being here. If you want to maybe hang out in the background just for a few minutes in case students have questions, feel free to message Coral directly or message me, and then I'll forward over to Coral. I'm not sure if you can message each other directly. But with that, thank you, and we'll move into our next part of the event. All right. Cool. So I'm going to, let me go ahead and remove the spotlight. I'm not exactly sure how to do that. Let's see. Ron, do you know how to remove a spotlight from somebody?
Yeah, I can remove, and if you'd like, I can also pin our DO pin.
Yes, please. Thank you.
Of course.
All right, thank you. So Dr. Wolf, Dr. Kurisu, and Dr. Hernandez is running a little bit behind with patients, but I think he's going to log on soon. Awesome. Okay,
All right.
so everyone, and we have Dr. Hernandez joining right now. If you can pin Dr. Hernandez, Ron, that'd be amazing. Cool. All right, everyone. So we're going to move into a panel discussion. So what we'll do, we have 3 different DO physicians joining us today, which I'm really excited about. We're going to have each physician introduce themselves, just a quick, background, quick intro. And then what we'll do is we'll move into the panelist discussion questions. I'll go ahead and kind of call out the physicians who I'd like to answer, because I'm just not sure that all 3 of you can answer each question. So I'll do my best to kind of moderate that. So we'll actually start with Dr. Hernandez. If you can do a quick intro, let everyone know kind of a little bit about your background, who you are, and yeah, take the floor. And then make sure you unmute yourself. There you are.
Can you hear me now?
Yes.
Yes.
Awesome. Hey, everyone. My name is Raul Hernandez Rubio. I'm originally from San Juan, Puerto Rico. I did my undergrad at Cornell University in Ithaca, New York. Took kind of a non-traditional path. Afterwards, I thought I wanted to go to vet school, and then I decided I wanted to pursue medicine. I did a postdoc at Hahnemann Hospital, which is now closed in Philadelphia, Pennsylvania. I did my medical school at PCOM, Georgia. I did my ophthalmology residency in PCOM, Philadelphia. And I'm currently an oculoplastics and orbital disease and neuro-ophthalmology fellow here in San Diego. I'm very passionate about mentoring and helping people who are struggling to fulfill their goals, and I'm happy to help any way I can. Should I unmute?
Jade, you're muted now.
Oh, got it. I'll go ahead and ask Dr. Wolf to do a quick intro. Thank you.
I'm Rick Wolf. I'm a maternal fetal medicine subspecialist here at UCSD. My career pathway started out as a corpsman in the Navy. So I was active duty as an enlisted man as a corpsman for about 6 years. And then during that time, I got my undergrad finished out, graduated from San Jose State about the same time I finished out my enlistment, and got picked up by Des Moines University for osteopathic school. I then was in the military scholarship for going to medical school. So after medical school, I went to my residency at Oakland Naval Hospital up in Oakland, obviously, California. That closed while I was there because of budget changes and kind of relocating where the military was. And so I finished out my last year at Tripler Army Hospital in Hawaii. I can hear the violins going right now, but I had to go out to Hawaii for a year to finish out my residency. But it was a great experience. I then was about 4 years as a general OBGYN physician here in Southern California, both at Balboa Naval Hospital, but also up in 29 Palms, up in the high desert. And then I then did a fellowship in maternal fetal medicine, high-risk pregnancy and imaging here at UCSD. Went back to the Navy, finished out my time and retired from the Navy after a total of 20 years and came back to UCSD. And I've been at UCSD now for about 20 years as a maternal fetal medicine. And so I'm now a full clinical professor in the OBGYN department.
Amazing. Thank you, Dr. Wolf. I'll hand it off to Dr. Kurisu to introduce himself.
Yes. Can you all hear me?
Yes, we can hear you now.
Okay, yeah, sorry. I'm driving. I had a flat tire, so I just got that repaired. I'm driving back home. So I'll be on camera in about 7 minutes here. But just quick intro. My name is Michael Kurisu. I started my career at undergrad as a student at UCSD. I was interested in the mind-body connection, but more interested in modeling that in computers. And at the time, this was 25 years ago, at the time, in computational neurobiology was just taking off, and UCSD had a new department called cognitive science. So I decided to go that route and was writing, a lot of different things of early code of neural networks and such, and then took a left turn, and the mind-body medicine avenue allowed me to do that because I needed a backup plan. I always knew I wanted to go to medical school, but my backup plan was to be a massage therapist. And so I became a massage therapist and started that as a job. And someone said, well, if you're interested in massage and you're interested in medicine, you should really check out what a DO was. I had no clue what that was. And the person that told me that was at the UCSD Career Services Center. So, and that's in the middle of campus. And I still have the handout they gave me to that day. I was like, what is a DO? When I first learned about this and I started reading about it, I'm like, hey, this is right up my alley. It's everything that I've always wanted to be. And so I switched everything and just only applied to DO schools. And, during that time was really interested in what osteopathic medicine had to offer. It fit what I was doing because a lot of the hands-on treatment was already there and became very specialized in OMT. I went to Touro University, which is up in the Bay Area. At the time, it was called San Francisco College of Osteopathic Medicine. They've now moved off campus to Vallejo, California. I did 4 years there and then decided to come back to UCSD for a family medicine residency. So started in early 2000s in family medicine residency there. And at the time, I was the first DO that was accepted in their family med program. And since then, we've established a large number of DOs that are applying to family medicine every year. I stayed on as faculty and one of the founders of UCSD Center for Integrative Medicine. So the biggest contribution that I brought was bringing osteopathic manipulative therapy and OMM to UCSD. It took about 6 years to build all of that from the back end billing and reimbursements, but we now have a fully functional osteopathic manipulative clinic. And we have a research component to that as well. And I ran the Center for Integrative Medicine for about 15 years and recently have stepped away from that in the clinical world to start a new venture on how, coming back to my roots of technology and medicine, but looking at it through the lens of lifestyle change and holistic interventions that people are doing in their lives.
Thank you. That's so amazing. I love how we have just a wealth of background between the three of you. So I'm excited to get into these questions. And again, thank you for taking time out of, I'm sure, your very busy schedules to be here and to speak with our students. So our first question I'll direct toward, I'll actually have all three of you answer the first question. So we'll start with Dr. Hernandez. Was osteopathic medicine something you discovered while planning for, quote unquote, the traditional or MD route? or was it always your planned career? In other words, how did you discover osteopathic medicine? And I know some of you talked a little bit about this, but if you want to go a little bit deeper, feel free to do that.
Yeah, so I started with I applied, like I said, initially I wanted to do become a veterinarian. And then turn of events, long story short, my mother got sick. That experience of seeing the doctor save my mom, that reward that I felt as a family member, kind of stuck with me, kind of still sits with me to this day. And I was always hesitant to pursue a career in medicine because my dad's a doctor, my grandparents were doctors, etc. So I, kind of wanted to break the mold, but I guess it is really genetic. So I applied the traditional route. I took the MCATs. I applied to allopathic medical schools, interviewed, did not get accepted, and I didn't even know that osteopathic medical school existed until I did my postdoc, where one of my teachers, one of my professors there spoke about osteopathic medical school, and I read more about it. My parents are both foreign medical grads. They had no idea what a DO was. So I did a lot of research. I applied to both MD and osteopathic schools. I ended up, long story short, I ended up getting accepted to a Caribbean school and actually started a Caribbean school. And I really didn't like it. And 3 weeks in, I received an email saying that I got accepted to Georgia PCOM. So I packed my bags and left to Georgia. So never looked back. Really enjoyed my time in Georgia. Learned a lot. Don't regret it one bit. Does it have its hurdles? I think it definitely does. Something that we can definitely touch more on, when applying for residency or fellowships as a osteopathic medical grad. But yeah, to answer your question, I did not know what a DO was when I started, but I feel very blessed that I did. So
Amazing. Thank you, Dr. Hernandez. I'll go ahead and direct the question now to Dr. Wolf. Was osteopathic medicine something you discovered while planning for traditional med school or the MD route, or was it always your planned career? In other words, how did you discover osteopathic medicine?
So it's a good question. Again, back to my initial foray into medicine was really as a corpsman. My mother was a nurse and my dad was an engineer, and so this combination of mindset was, first off, I always was interested in fixing things and doing things with my hands to make them better. Taking things apart, putting them back together again. If something didn't work, trying to figure out why and trying to fix it. But those were things I was doing, physically with my hands. And as I got a little bit further in my life, I was more fascinated with the biologic structures and functions. And when I took anatomy, and particularly comparative anatomy, it just really sunk my teeth into, or that really sunk the teeth into me. This is something I really wanted to get into. So that was kind of why I became a corpsman, just to be in the medical field, and as a corpsman in the Navy, you have a lot of responsibilities for taking care of your crew or your team, but you work with physicians as your medical officers. They're the ones you report to. They're the ones who give you more training. They're the ones who are going to kind of make sure that your treatment of your team is appropriate. And what I found was that many of my medical officers were DOs. Now, this is 40 years ago. You have to understand that things change over time, but many of my officers were DOs. There were MDs as well, and I could see a difference in the way that they approached treatment. I think that was kind of pointed out by Coral a little bit. The DOs had more of a tendency to want to know more about not only what the symptom was and the direct treatment, but what was underlying the problem, what was going on with the family or the work. Did they have other things going on? They might do osteopathic manipulative medicine treatments. There might be other things that they would do besides simply saying, you have this symptom, here's your drug, goodbye. And so I really like their approach, that it goes along with the osteopathic tenets of the body being able to heal itself, and that structure relates to function, and being able to put these things together in a treatment formality. So that's what really kind of set me towards wanting to be an osteopath as opposed to an MD. When I was in my early stages of exposure to both, and being able to decide where I wanted to apply.
I like that. Just kind of the overall philosophy of what the physicians do who are trained in osteopathic medicine, and kind of looking at the patient as a whole versus, I know MD is more algorithmic in its approach. What is the patient presenting with, what's on our differential, and what's the diagnosis, right? So I think that's really cool that that was your experience, and that's how you wanted to pursue your careers, and kind of understanding the patient holistically. That's amazing. So I'll now direct the question to Dr. Kurisu. Was osteopathic medicine something you discovered while planning for traditional medical school or the MD route, or was it always your planned career? In other words, how did you discover osteopathic medicine?
Yeah, so backing up to my story, I planned. I was been a special case because I always knew I wanted to be a physician from a very young age. Even in grade school, I knew I wanted to go into the medical field, and I really looked up to my pediatrician in grade school. And so I just had this goal ever since, I was like, I got to go to med school. And knowing that I just got to get to med school, and I just thought that was med school, and everyone's applying to MD school. So it was literally that handout I got from UCSD Career Services on a call just like this. It's like, all right, what is a DO? And that's what changed my entire trajectory. And so that's the discovery process for me, was that diving into it and understanding, what it is. And I think, Dr. Wolf and Dr. Hernandez have spoke to it a bit. And, really it's this philosophical difference of the approach to the patient, right? You're looking at one of my mentors said it perfectly, is like, allopathic medicine is looking at disease processes and pathophysiology of disease. Osteopathic medicine learns that, but they're interested in the health aspect of the patient. And so when you combine those two, it's a different practice and philosophy. They're not one's right, not one's wrong, but it tended to agree with the way that I approach life and how I approach people. And so that's that discovery process was like, hey, this is right up my alley. This is what I want to do. I'm with kind of like-minded people, and then the rest is history from there.
Yeah, I like that. Kind of finding your tribe, right? So you feel that sense of belonging and kind of thrive in that environment. We may kind of go through the questions out of order just because we're getting some questions in the chat, and also some things are kind of coming to mind. But what would you say, and maybe I'll direct this to Dr. Hernandez first, what would you say to someone who is apprehensive about the DO route, and maybe their reasoning is, I really want to specialize, and I hear that I can't specialize if I go the DO route? Because I do hear that a lot, and we've gotten those questions from students. So I would like you to kind of touch on that.
I think that's a very valid question. I think it's very reasonable, and there's a lot of truth to it. Unfortunately, there is still a stigma against osteopathic applicants, especially in competitive subspecialties. I had a pretty decent application for ophthalmology, and it took me two years to be able to match into ophthalmology. And a lot of these programs straight up told me that they wouldn't take me because I was a DO. Same thing with fellowship. I had a very, very, very strong fellowship application in terms of rec letters and stuff. And a lot of the programs I interviewed with would not take me because I'm a DO. So the fact that, there is some people who are apprehensive to applying, it's very valid. But there's definitely things that you can do to change about it. First, we as we continue to train, as we continue to bring forth people that are applying to osteopathic medical school, they need to really be in the mentality that they're no less than their MD counterparts. But they're also not superior to them. Like, we need to make the stigma that where they're equals, we have the same training, we're learning from the same textbooks, and we're learning from the same anatomy, we're learning the same physiology. And the more you accept that and becomes your truth, the sooner the stigma of DOs are inferior is going to break. Another thing that that helps is, you know, identifying the people that are already in your field that you wish to pursue. So, for example, I knew I was a DO applicant and that my application would be that part of my application would be observed and it would be recognized. But you know, come hell or high water, I wanted to be an ophthalmologist. I wanted to be a plastic surgeon, and I thought my mentors were the best of the best. And the best of the best wrote rec letters for me, and the best of the best took me in, and the best of the best are training me now. You know, were there people that said, sure, like the best of the best trained you and wrote your rec letters, but you're still a DO? Yeah, that happened. It happened quite a few times, but I still managed to find people who are, you know, world renowned that are, you know, currently trained me in the past. So if you're applying the DO route and you want to be a subspecialist, you absolutely can do it. It's just going to be harder. And you have to recognize that you're just going to have to work a little bit more to get the results that you want. If you're okay with that, that means that you actually want to do that subspecialty that you're interested in doing. So those are my 2 cents.
Yeah, and I also hear the need for networking, which is what I talk to my students a lot about. Every time they see me, I'm like, look, it's really important in whichever career, including medicine, to network. You know, you talk about having these great people in medicine train you, and that has really helped you on your trajectory. So I really like to hear that. I'll direct to Dr. Wolf because I know your specialty is OB, and many students want to go into OB that I talk with. So I would love to hear more of your thoughts about specializing.
Okay, so I'd start with the fact that when you're looking at specializing and subspecializing, most of DO students coming out of medical school and going into residencies are going to be in primary care fields. If I can share a screen for just a moment. This is off of the National Resident Matching Program from 2023. And you know, about 2/3 of DOs that get into residencies following their graduation or entering from their senior year of their medical school, DO school, whatever, about 2/3 are going to be in primary care. So that's family medicine, internal medicine, pediatrics, and OBGYN, maybe ER. You know, those are the primary places that people go. So if you're a person who's thinking that you want to be in a primary care field, the DO route is perfect. Just showing quickly to the left here, I want to point out that as time has gone on, the number of DO schools and the number of DO graduates that are out there has been increasing over the years. You know, just to give you an idea, back when I was a medical student, there were only 15 osteopathic medical schools in the entire United States. Now there is closer to about 50 schools with 66 locations that you can go to. So the number of schools has quadrupled over that time, or places you can go has quadrupled. And so needless to say, the number of osteopathic students that are coming out has also significantly, exponentially increased. So why is that a big deal? Well, mostly because when you're looking at kind of like what Dr. Hernandez was saying, I think you need to familiarize other people with DOs, and I think that's happening because there's more and more of them in the field. If you look at where these people work, most of these are going to be in the Midwest, but they're spread throughout the country. These red dots are where the osteopathic schools are. It kind of makes sense that you can have more either in the Midwest, because that's where a lot of the osteopathic medical schools are located, but also through the South. Those are places that are pretty heavily endowed with osteopathic medical schools, and with osteopaths who work afterwards. So, really it's trying to show that you have a lot of people out there. When you're looking at going to subspecialty care, that's where you're going to start getting into problems. So kind of like Dr. Hernandez, going into oculoplastics, myself going into MFM, I was very, very fortunate in that the way that my training was post osteopathic medical school was really kind of military residencies. And again, I was very fortunate in that the person that I interviewed with here at UCSD was former Navy, so we had a little bit of a connection. And it didn't matter whether I was a DO or an MD. What he was looking at was, what do I have to bring to the program? What are my capabilities? What have I shown myself to be capable of in my not only medical school, but prior to that, what were my life experiences, and more importantly, once I was a physician, what did I do? So I always tell people that no matter what you do in life, as far as applying for jobs, applying for residency, fellowship, or whatever, usually it's the last thing that you did that's going to count the most. So if you did an OB residency somewhere, they're going to look at that, and secondarily they'll look at your medical school, and tertiarily look at your undergrad. They're not going to care what you did in high school, if you follow my drift. And each time you move up, they're going to look at what you did last. So obviously, if you're finishing out your osteopathic medical school, you want to be shining in what you're doing there, as far as your grades and what you do with extracurricular activities, just like getting into medical school. That continues on when you're applying for residencies and for fellowships. You need to show continued interest in what you're doing, continued drive, and being involved, hopefully as a leader, doing research, doing something that shows you are different than the average person, whether you're a DO or an MD. That doesn't matter. Now, there are going to be some programs, as Dr. Hernandez says, that if you're looking to get in right out of osteopathic medical school into a subspecialty training, where that's where the track is, you might have more difficulty than if you're coming out of an MD school. But there again, it doesn't mean the MD schools are going to be any better training at the things that you need to know. I think it's going to be what you bring to the table when you go to see these people, the people that you've worked with who write good letters, and what you're doing, again, whether it's in medical school or in residency, to go on to a subspecialty. You need to show that you're showing continued involvement, that you're still trying to strive to be better, and not just relying on the fact that, okay, I'm done with school and I'm done. And don't do that. Medicine is something where you'll learn is a continuing evolution. You're always learning something new. I learn something new every day. In seeing my patients, I see something weird on an ultrasound and I have to look it up, something I haven't seen before. There's always something new that you're going to learn. So keep learning. That's the goal as a physician. So I'm not sure if I'm going off in tangents here, but the good thing is that there's more DOs out there applying for residencies. Again, roughly about a quarter of all the U.S. grads from osteopathic and allopathic schools, a quarter of them are osteopathic school graduates. So you're seeing a lot of these graduates coming out, going into looking for residencies and getting matched.
Absolutely. Thank you for sharing that. we make it a little bit, because you touched a little bit on extracurriculars and you know, what that should look like. Maybe we'll get back to that question, but I want to get to question number 2, go back to that one. And I'll direct this to Dr. Kurisu. What kind of clues led you to follow the path that you've chosen, and how might students look out for similar types of clues?
Yeah, no, thanks. Great question. And I think we've touched a little bit on this, you know, as you're trying to figure out your path in life. And we're not here saying that, you know, the DO route is right for you. It was right for me. It sounds like it was right for Dr. Wolf and Dr. Hernandez as well. But you have to figure out what's right for you. And again, the way that I looked at it from the osteopathic perspective, to me, again, it's that philosophical way of living, and it coincided with the way that I viewed life. And so that's, you know, that was one of the major clues. It's like, hey, this philosophy of how to approach patients is like how I approach my lifestyle. And so, you know, I was talking with someone else from admissions from a different med school, and you know, they were saying that they can tell if someone who is applying to medical school, would they make a good DO candidate? And this is someone admissions at an MD school. Let me just preface it with that. So they're at MD school, because there's a lot of times there's students that end up in MD schools, and then they're like, oh man, I really wish I knew about this DO thing, because I think I would have been happier there. And so when I was asking the admissions person about this, they're like, well, how can you tell that they're, you know, they're a good DO candidate versus MD candidate if they've all taken the same organic chemistry, biochemistry, MCAT, and all that? And she's like, it tends to be what they spend on their extracurricular activities, how they approached their application process with their personal statement. You know, their personality really came out, and you know, she had a really good kind of sniff test of like, hey, this person would make a really good DO. And again, I think a lot of this is that, you know, philosophical approach to health, you know, and so you just really read some of the readings on, I can put in the chat some good books to read in the pre-med stage of what, you know, what is a DO, what's the difference between all of that, and really get down to and answer a question, you know, is this right for me? And then again, also try to hang out with a few DOs here and there, shadow and see what they do, and see if you can see a difference in the way that they approach patients and the way that they approach their practice. And so those are the subtle clues. There's not, you know, not a glaring clue that's out there, but those are the subtle clues to look for.
Absolutely. I wanted to ask, going back to extracurriculars, because I know students will have a lot of questions about that. And you also just mentioned shadowing Dr. Kurisu. And when I work with students, I think one limiting step for them is finding physicians to shadow and to ask questions and to maybe even like write them letters of recommendation. So we'll stay on you, Dr. Kurisu. I want to direct this towards you. What did your extracurriculars look like, and how did you balance them? And if you could also talk about shadowing and how you approach that as well.
Yeah, great piece, because shadowing is always, I mean, getting the letter of recommendation for a DO to go to a DO school, I still think is a good tradition to have, because you need more exposure to what the philosophy and the profession is. It's a little bit of a challenge because, you know, DOs are kind of few and far between. Everyone's so busy. You know, sometimes you don't pick up on those subtle clues, and you get a little confused in the process. I'll get back to, you know, the original question on extracurriculars. I do think that is something that makes you stand out in your application. There's, you know, the two factors on admissions process that make you stand out is your personal statement, number one, and then what do you do outside of all these other schools? Because on paper, everyone looks the same. You know, you're taking the MCAT, you're all taking your necessary prerequisites to get in, but what sets you apart? Like, where are you spending your free time? What are you doing with that free time? And, you know, how is that impacting you personally? And extracurriculars can be, you know, the more diverse they are, the better. You know, if someone's coming to medicine and a theater major, you know, that to me strikes interest in someone, you know, who might look like the rest of the pile of applicants that are out there. I might want to talk to that person. So, you know, the more diverse that you are, the better. And then, you know, the whole shadow question. So at UCSD, when we were starting to get more DOs in the family medicine department, we started to get
more and more people shadowing. And I'll put in the chat here in just a second the name of the person that you can get a hold of that has started the shadow mentor program for the DOs that are in the family med department. We have a private practice as well, the Osteopathic Center of San Diego. If you want to shadow some physicians there, you can look at doing that. And they do hands-on osteopathic manipulative treatment. You can come and shadow the physicians that are there. So I'll put those in there to do, because you can get the letters of recommendations from those DOs, from those sources.
That's amazing. Thank you for sharing that. Maybe we'll reach back out to you, because we have like a kind of a toolbox of resources that we share with our students who are interested in certain specialties or certain areas of medicine. And so maybe we can share that with some of our other students who are currently not in the event.
Sure.
Thank you. I'd like to, well, first I want to say that Dr. Hernandez, he had an emergent case come up. As you saw, he was at work, and he took time out of his busy schedule just to speak with everyone. So I'm really appreciative of that. But I would like to direct the same question to Dr. Wolf. What did your extracurriculars look like? How did you balance them, with your personal life? And what, I guess, resources or advice would you give to students in that area, including shadowing?
Okay, so I would start with, again, my undergrad, which is, I believe, where all of you are now and thinking about applying to medical school and osteopathic medical school. Have to understand that back when I was an undergrad, I was active duty in the Navy. So what that meant was I was working probably 100 hours a week with call. So I learned about being on call, which meant that at the end of my workday, I would spend the night in the clinic overnight, and then work the next day. So you basically were working 36 hours. So the amount of extracurricular things I was able to do was kind of limited. So what were some of the things that I did? Well, I tried to make some of them medicine oriented, so obviously the pre-med club and things like that, so I was active with that. I was active with the local Boy Scout troop that, as a junior leader, so to speak, help them setting up their camping stuff. And I was their medical person for in case they had a problem out in the field. Those are some things I did. I was also married, so I had a married life to deal with as well. So I was pretty busy. So it's difficult for me to tell anybody what to do as an extracurricular activity, other than to say, do something that you're going to be passionate about, something that you're really interested in, and get involved with. Try to be in a leadership position if you can. Make it something that's going to be interesting on your application and your personal statement. That this is something that shows your interest, your passion in not only medicine itself, but also in people, in interacting with people. That you are going to be someone who's going to be a leader in that way when once you're done being pregnant. Being a teacher as well, doctor means to teach, docer, so doing something like tutoring might help. Something where you're helping other people learn what you know. Mentoring is something that can be helpful. But really, again, my pathway is different than the traditional, and kind of like going off to be a veterinarian and finding out that that's not the way you want to go. It's I would say when you're looking at osteopaths going into medical school, we have a tendency to have a different background starting up. The thing that I see in my head of my partners now, who are mostly MDs, is they went to high school, they went to undergraduate, then they went right into medical school. It was boom, boom, boom. You know, they're good people. I don't want to take away from that, but I don't think they had a lot of life experience, and sometimes it shows in the things that they do with their patients. They don't have empathy in the way that I would like, and so I think the more that you're around people and you know dealing with people, the better you are. I thought it was very interesting listening to Coral talking about at Western University. One of the things that they do is they have you go to see a mock patient. Well, you're still a pre-med. You know, how are you going to go and see a mock patient? Well, what they want to see is how do you interact with people? You know, go in there with a feeling of confidence. You're talking about, you know, so how's things going? You know, so what can I do for you today? You know, have them tell you about what their problem is, and then you know listen actively to what they're saying, and then try to respond with some questions about you know what are their symptoms or whatever their complaint is, whatever their practice patient is trying to tell you. But the point is that that's what they're trying to do. They're trying to see how you interact with people. It's kind of like going to a cocktail party of people you don't know. You're thrust in there. You know, maybe your wife or your girlfriend is at this big sorority or fraternity, you know, whatever it may be, and you're going there as an invited guest. You don't know any of these people. Well, the thing that you need to do is you need to start making your way around because you're the person who invited you, your wife or spouse or what, you know, the significant other, whatever it may be. They've wandered off to somewhere else, and now you're standing there by yourself. Now, what are you going to do? Stand there in a corner and just you know wait for that person to come back with you? No. What you need to do is you need to go into the crowd, start introducing yourself, and start to you know to intermingle, and that's kind of what that practice patient's going to be about. So, and again, back to extracurriculars. That's what they're trying to see is that you are able to you know function in a big group. That you're capable of being part of a team, you know, whatever it may be, in accomplishing a goal. So those are some of the things I would look at extracurriculars. Just to touch on the shadowing part, I have shadowed in the past. I will say that shadowing with me is probably not the best thing, and here's why I say it. As a subspecialist now, I'm in maternal fetal medicine. Most of what I do has a tendency to be reading ultrasounds. You know, that's what I do now as part of my specialty, and doing consults on complicated patients. You know, so somebody who has chronic hypertension or diabetes or twins or some problem with the pregnancy that's going on, not growing well, preterm labor, whatever it may be. You know, those are the patients that I see now. But my interaction is not the same. And most of my interaction, quite honestly, is with the sonographers and my screen looking at images. So screening with me, I don't think is quite, or shadowing with me, I don't think is quite as helpful. I don't think you're going to see what a DO really does. And, you know, quite honestly, once you get into a subspecialty position, the amount of difference between osteopath and allopathic is really, really subtle. You're not going to see a whole lot once you get to that level. I think when you're at your as a primary care physician, it's way different, way different. Those are the ones that you can see a difference right away. And so those are the ones I think it's better for you to shadow with, to be honest. And so COVID came along also and kind of killed the shadowing that I'm able to do or have been able to do through my department. Probably for the, you know, not only since COVID came around, but even before then, they were kind of limiting the amount of shadowing we could do in our department and in my division.
Yeah, that does make sense. COVID did change a lot with shadowing. But these are really good pieces of advice from both of you. Thank you so much for that. We're going to move into the last question, and it's kind of like a final kind of advice, and I'll direct this to Dr. Kurisu. What was the most difficult part of your journey to get to where you are today? And is there a word of advice that you would like to give students in general that may be going through something similar?
Yeah, I mean, that's a good question, just because the whole process is arduous and difficult, and it always seems like you're going uphill, right? All your friends are having fun in college, yet you're a pre-med student and you're taking 20 units a quarter, and you think, wow, I made it to the end, I made it into med school, and then it ends up being 80 to 90 units per semester, and you're like, wow, that was a lot. I've made it through that. And then there's light at the end of the tunnel. I become a doctor, and then you turn into an intern and resident, and there's a train that's about to hit you, and you're working. You know, we're dating ourselves here, but I was working the same, 100 hours a week. They have rules now. You can only work 80, and it's like, wow, only 80 hours a week. This is twice what the general population is working, and you still don't even have a paycheck yet. And so it's like, the whole process is like, I don't want to go through it again for sure. So I don't envy all of you. But I mean, to be honest, when I look back on it, the most stressful piece to me was where all of you are right now. It was like that initial process of getting all the prerequisites done, applying to med schools, doing the interviews. Because once you make it into medical school, then it's not a downhill process, but you found your family, right? You found that area where you're going to be. Then you find what specialty you want to be. Then you're in your residency, and you keep narrowing it down. But it's getting onto that first step. It's like boarding the train for that first piece. To me, was the most stressful piece. It's like, wow, this is a big journey, and I have to take this. So I don't, like I said, it's not all gravy after you get on that train, but it was, to me, like the most difficult piece about it. True, there are other times when it's like really hard, and you you're a student one day, and then a week later you're a physician in charge of patients who might be dying in the hospital, right? So this level of responsibility and the learning curve is so steep, and we talk about that all the time with students, of how steep these learning curves are, and building up those necessary skills for that. So I do think it is a long process. It's a marathon. You have to learn. I would suggest maybe go train for a marathon, just so you can have some sense of analogy of like what it's actually going to take for the rest of your life, kind of thing. But it's not a sprint towards the end. The finish is always going. Like Dr. Wolf said, I'm still learning every day. We have to take CME. I learn a lot from the students that come and help out. I learn a lot from my patients every single day, and there's always something. So it's this continually learning environment that keeps going. So if you enjoy that, then yes, if you find joy in this aspect of being able to learn like that, then by all means keep going for it.
Thank you, Dr. Kurisu. Dr. Wolf, do you want me to repeat the question, or you got it?
No, I think I got it. The most difficult part for me, quite honestly, was the undergrad. Now, I want you to understand again, I was a full-time Navy sailor, and I had my responsibilities as a full-time Navy sailor while going to school. So I've heard before from my other colleagues here that you see your friends going to school and they're out partying, having a good time, and meanwhile you're thinking, I've got to get this stuff done. And it's funny. I would almost though say the opposite of what Dr. Kurisu said is that looking back on it, that was a lot of fun, actually. When I really think back about undergrad and getting through it, the hardest part of medical school, honestly, is getting in. But once you're in, it's good. You're going to work hard. You're going to study harder than you ever thought you would. But the medical schools and osteopathic medical schools, they want you to succeed. They want you to do well. If you're not thriving there, then they're going to get you help, tutoring, whatever, extra time. They want you to get through there. And then, the nice thing, as Dr. Kurisu was saying, once you're done, you're part of a family. You're in the medical field. The best thing is you are now practicing the thing that you've learned I think back to my undergrad, and I think of some of the things that I learned in undergrad, and I'm thinking, why did I even take that? I'll never use that ever. Entomology, for example, I learned entomology, learning about insects. But I I still have my entomology book on my shelf because every now and again I'll pull it out to try to figure out what bug just crawled on my finger or whatever. But that aside, that was probably the hardest part was just getting through the things that were required, whether it's organic chemistry, whether it was physics I had fun with, the science stuff I really enjoyed. Some of the other parts of the education where you kind of round out your education, some of that stuff again, I don't think I'd use it again. I appreciated learning English, and sometimes I wonder if some of my colleagues took English in college, when they write some things on a chart. But that was the hardest part. Persevering, it was because I could see the light at the end of the tunnel. I could see, as my credits were building up and I was getting closer to being able to apply, I could see that there was a goal, and I was going to get there. Past that, Dr. Kurisu was saying, you're one day you're a medical student, the next day you're a doctor, and you're responsible. My first rotation as an intern was in the ICU CCU, and it's exactly that. I had patients who died while I was their doctor, and it's a humbling experience to realize that as much as you think there's still things that you don't know, and that's part of the wanting to keep an aura of discovery, learning something new. My residents come to me almost every day and say, "Why do we do this way?" And it's like, I have to think about that. Doing evidence-based medicine and looking at the studies. I had a doctor who I was on call the other day called me and said, "I have this patient who has this weird ultrasound," and I looked at it, and it's like, I know what that is. It's a rare thing called placental mesenchymal dysplasia, PMD. I've now seen it 3 times in my career, and yet I was able to look at that and go online while I'm talking to her on the phone and looking up and making sure that that's what it was. What are the ramifications of this? What's this going to do as far as her prenatal care and her delivery? So that's all part of discovery. You learn things every day. So the hardest part for me in the journey was undergrad. The main thing I would say in response to that, word of advice going through a similar process is persevere. Okay, and I'm serious about that. If you don't get in, your first time, don't give up. Reapply, but do something in the meantime. Do something that sets you apart. Whether it's going off to climb Mount Everest, whether that's becoming a star in some local Broadway production. Do something that sets you apart, that makes you an interesting candidate. As has been said before, it's not all MCATs and GPA. That's part of it, but it's the whole person that they're looking for, and so persevering is the main thing I would say. The other thing I would say is, to be honest, develop a backup plan. If you don't get in the first time, what are you going to do between then and reapplying, or are you going to change your ideas and move on to something else? Be realistic about what your chances are. Now, to that end, Coral from Western University, that sounds like a really nice resource. I've never heard of somebody saying, we counsel patients on their applications. It's like, wow. If that's the case, take advantage of that. Give her a call sometime and say, what can you offer me? Not just Western University, but what can you offer me as far as advice on my application? What are you looking for that I'm missing? Or what do you think would make me a really good candidate for your school? Because if it's good for their school, it might be good for other schools. So just something to think about, as you're in this application process. It is a process. It's a slog getting it through it, but the rewards are really great. And I don't mean monetary. It pays pretty good, but it's not that. It's not all money. It's actually what you do for a living. Being able to do what you're trained to do, and do that for the rest of your life. Some people say, I don't work a day in my life. That's me. Every day I come in, I see something new. I'm anxious to see my patients. I'm anxious to see my sonographers. I'm anxious to do my job. I get up every day excited about what I'm doing. And that's what you should be thinking about. Is this going to make you excited to get up every day to see your patients? If that's the case, then you should continue to pursue medicine. If it's something it's not, if you're thinking of something else, then maybe medicine isn't for you.
Yeah, absolutely. Thank you both for those great words of advice. I know students, I'm sure there's some students who perked up when you said for you, the most difficult part, Dr. Wolf, was undergrad, because they're like, okay, just need to get through undergrad, make it into med school, and then hopefully, then it's just the step 1, step 2, step 3, and everything else. But that was interesting to hear. I just think in general, life, as you grow older and have more experience, it just does become harder, but you learn to deal with the challenges that come at you with more experience. So I just think that's more in general. But I want to thank you both. We have about 10 minutes left. If anyone has questions, feel free to put them in the chat. We did have one question that we didn't get to touch on by one of the students. And they asked, do you feel that there are any limitations to being a DO rather than MD? I didn't want to ask that before just because we kind of talked a little bit about it. But again, there are some student concerns about kind of choosing one path or the other. I really do think you all did a great job of talking about the strengths and the highlights of going into DO, as well as some of the more difficult parts of pursuing this path. But if you have anything else to add, feel free, either of you.
One thing I'd point out, that some people think that you're going to somehow get a reputation, whether it's in your clinic or in your group or wherever you're trying to work, as being a DO as opposed to an MD. I think that there may have been some prejudice, let's say, a long time ago, particularly if you are seeing your patient for the first time and they don't know what a DO is. It's like, how come I'm not seeing an MD? Aren't you a doctor? And I think that over time, again, the number of DOs that are out there now has significantly increased. I think some of that prejudice has diminished. It's not gone. But in general, my patients call me doctor. They're not looking to see if I'm a DO or an MD, most of them. And if they ask me anything at all, it's like, oh, what's a DO? And then I'm able to tell them, I'm a physician. I've gone to medical school. I've done my internship and residency and fellowship. I'm fully trained. I'm fully capable. I think of an osteopath as being an MD plus. So I do all the things that MDs do. Plus, I have the osteopathic philosophy. I've trained in osteopathic manipulative medicine. And so these are things that I think are extras. But I would say, other than perhaps applying for subspecialty fellowships, the rest of it, I think you're on an even track for the most part. But it's really, it's you that makes the difference, not the 2 letters after your name. Is what you bring to the table in your total package that makes a difference.
Absolutely.
Yeah, I'll second that. That's a very valid point. And I like the fact that you had 2 subspecialists here that were DOs. I mean, one of my best friends, he's a neurosurgeon, he's a DO. So, I mean, it can be done. And it's the personalities of that particular person. They come to the program and they say, hey, we want this person on our team, and so I think the stigma is going to go away at some point. You know, when you said there was only 15 schools and now there's 50, right? So we were back then that the ratio of DOs to MDs was 1 to 10. Now it's 1 to 4, and in another 5 years it's going to be 1 to 3. So, you know, 30%, you know, 1/3 of the entire workforce of physicians are going to be DOs out there. And I think the world in this next generation is going to see that, like, hey, they do have something to offer. So I think the pendulum is going to definitely shift. You still might encounter some stigmas here and there, but again, like Dr. Wolf said, it's your personality, it's what you bring to the table that's going to make the big difference, the big difference maker. The last thing that I'll you know can end on, really, unless there's more questions, but you know, you did bring up that word of persevere, because it is a long, arduous process. You know, this is a decade of learning that you're going to go through, you know, starting now to get on to board all of this. So if you do have time to take for yourself during this time, even though we both said, like, the undergraduate, this process right now is the hardest piece. But if you're like, hey, you know what, I want to take another gap year because I've always wanted to visit, you know, Western China, or I want to go down to see Australia or South America, whatever it is in your life that you want to do, I would say take the time to do it now, because it's too hard to find the time later. You know, and this advice was given to me, and I actually took an extra gap year when I was applying. One, because the application process is a full year for the cycle, but you know, there's certain things I wanted to check off my bucket list, and if I didn't do that, I guarantee you I could not find the time to do that now. You know, even with the unlimited resources and stuff, you still can't find the time to do it. So, you know, if you're in a period of your life, you feel like you want to grow up quickly, the biggest advice is like, hey, you know, take some time for yourself. This is a long process. Persevere through it. If you need to take 6 months off before you apply, so be it. It's not going to, you know, they're not going to count that against you in your application. And, you know, if you have some things in your life that you're itching to do, go do that now, because once you start this process, there's things that happen, like internship and residency, and then you start a family, then you start a practice, and you know, the time is what gets sucked away from you. And so do things now, live now in the moment for yourself, and then you know, persevere through this entire application process.
Amazing advice. Oh, go ahead, Dr.
I was just going to say, but if you do take the gap year, which it's a great advice. If you do take the gap year, do something interesting. Make it part of your application.
Absolutely. I usually tell students that as long as you're productive, working on your core competencies, you know, whether that's working with patients or working in volunteerism, whatever that looks like, or just growing as a person, right? Make sure you can speak to that in your interviews and in your application. So I really just want to thank you both for taking time out of your busy schedules. And I really loved your insights. I think the students benefited greatly from your wisdom. If you are comfortable sharing your contact information with the chat, feel free to do so. And if not, we completely understand. So if you would like to, go ahead and put your email in the chat. I know, Dr. Kurisu, we got the link to the Promise program. So I'll be sharing that with my students as well.
And I'll be sending a little bit of a PDF that has some of the slides that I showed. One of the things I would point out is that a good thing to look at is the different areas where you can get information. So just to pull that back up again, these are some really good resources, you know, that have information about osteopathic manipulative medicine, osteopathic medical schools. I like this last one, this brief guide to osteopathic medicine. It was put out by students for students. And it basically kind of explains some of the osteopathic manipulative medicine part of your training in a way that I think is easy to understand. But all these are good resources, and I'll send a PDF that has all this to Jade, so it can be sent out to you.
Awesome. Yeah, we can email that out to the participants who were here today. So with that, I'm going to stop recording.